They did an examination, they did a few investigations, and the diagnosis came as polycystic ovarian syndrome. Does that mean you are infertile? Does that mean that you can never get pregnant? Absolutely not. Let me start with the basics. PCOD or PCOS, that is polycystic ovarian disease or polycystic ovarian syndrome, are one and the same. What exactly happens in polycystic ovarian syndrome? Let me give you two examples. We always had that one teacher in school who was really dominating, and we always have that one boss who keeps exerting their dominance over us. What happens if the teacher is absent or if your boss is not around? Absolute fun and absolute havoc. That's exactly what happens in the ovary. The dominant follicle, or the follicle which is destined to be released from the ovary in every cycle, which goes and meets the sperm and forms the pregnancy or the baby, is not formed in polycystic ovarian syndrome for various reasons. What happens next is the remaining oocytes or the eggs fight with each other, but none of them form the dominant follicle. Ultimately, they are arranged at the periphery of the ovary, which gives the polycystic appearance or the classic necklace-shaped pattern in polycystic ovarian syndrome. Why does polycystic ovarian syndrome occur? There is no definitive cause for PCOS. The theories or the causes that are thought to be responsible are stress, eating habits, lack of exercise, and genetics.
Most important tip is to get adequate sleep. You should be sleeping for 6 to 8 hours every night, and you should be in bed by 11 p.m. This is because the hormone melatonin is released when the night is at its darkest, and it's very, very important to help heal your body. The second point is that you must be having more of a simple, home-cooked, non-processed and non-packaged diet. That means that anything that comes from a packet, even if they say it's organic, even if they say it's healthy and diet, okay, there is a lot of preservatives and a lot of hormone disruptors in it, and in comparison to that, a fresh, simple, home-cooked meal is going to add much more value to your diet. Point number 3. You must be consuming a high fiber diet, which means there should be a lot of fresh green leafy vegetables and fruits in your diet. Point number 4. Your diet should be very, very rich in healthy fats, which means that it should be a diet rich with fresh fish, with whole eggs, with even chicken, with all your dry fruits and nuts and seeds, because they are a very, very great source of healthy fats, even your chia seeds, for example. Point number 5, make sure that you're having a high protein diet, which means that you should be consuming all of your white meats. Apart from that, you should be consuming a lot of dals, pulses and legumes, curd, chia seeds again, because they are also a rich source of protein.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.